Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient which you have requested. The area of interest is the lower right 5, 6, and 7, and the upper left 7 for future implant placement. Now, since the doctor hasn't mentioned a specific area of interest, so we are just going to go ahead and tell her about every area that has a problem here. So the lower right in particular, as you can see on the 3D rendering, has class 5 cavities of quite severe nature. Now on the panoramic view, we don't see any major radiolucencies. On the transaxial view, which is basically the proximal view, you will be able to appreciate that this is the mesial root, and the mesial root has, there we go, the mesial root has two canals, the mesiobuccal and the mesiolingual. Both exit on a separate apex. We've got these massive class 5 cavities on the lingual as well as on the buccal aspect. So this is the lingual one and this is the buccal one. The one that is of most interest to us is the fact that this class 5 cavity has actually come very close to the furcation area right here. So the doctor has to make a clinical decision as to whether she wants to save this tooth, and because this has a very poor prognosis due to the fact that this cavity has invaded quite close to the interradicular area. So hence this is something of note. Moving to the lower right second premolar, again massive class 5 cavity invading the pulp, which you can see right here. So class 5 cavity, pulp, and this is where the cavity invades the pulp. We don't see a radiolucency in any of the teeth yet, so that's something to be kept in mind. Moving to the lower right 5 and the lower right 7. The lower right 7 has a old restoration, but from our CBCT we can actually see that the old restoration is leaking from the lingual aspect and has actually caused secondary caries of quite severe nature, and this has actually led to the involvement of the pulp here. So hence this cavity is now causing pulpitis for this patient, and hence an endodontic treatment is indicated. Now moving to the upper left first molar region, this is where we've got a extracted area and a grafted area. We can see that this area has been grafted here. We've got a slight dehiscence in the bone due to the previous extraction, but nonetheless we can see that there is a graft placed here. We don't have a cortical plate here, but nonetheless we have very good adequate bone available for implant placement. We've got 8 millimeters of stitch width with a very good 12 millimeters of height, and hence we can very safely say that this area is ripe for placing an implant. We can't, however, estimate when this bone graft was actually placed, but however we can actually tell you that the volume definitely indicates that this is a good and ripe area for implant placement. So if you have any further questions, please feel free to reach to our team. Thank you very much.